problem came in when it on the issue of wage, and it is this 2.4 billion that we were unable to utilize in that financial year. And the reason was because that during that financial year, we had been given the money, but then Minister of Public Service had stopped us from recruiting, not only Entebbe, but it was cutting across all the different MDAs of government. So it was only opened up in February last year, and then this was almost like towards the end of the financial year, and we didn't have much time to recruit, and then this is how we ended up returning 2.4 billion. But good enough, the same money was given back to us in this other last financial year, and we have utilized all the money that was given to us. So in that year, it was an issue of time which became an impediment to this.
Well, have you planned to recruit more staff in this financial 2025-26?
Yes.
And how much money has been located to you? And how many staff do you intend to recruit?
For this coming financial year, we have been allocated. We are planning to recruit more people, and we have been given 1 other billion for wage, and we plan to recruit 21 staff under this.
And that pushes you to what percentage? From 21 to what?
Now 21 plus 26, that is 2, count 281. Now mathematics.
Let them calculate for you as we do proceed.
Out of 1195, and then we get a percentage.
Please get that percentage so that we can know the targets that you do have in regard to staffing, but we still take note that the staffing levels are still low.
Sure.
Because I doubt whether you will even exceed 23%. You'll be still below 25%, which is too low.
True.
And you know the consequences of understaffing. Number one, you compromise on the quality of service that you render to the people of the region that you serve. Number two, the medical workers are overstretched. So we really need to take this issue serious, much as we are allocated money, but it's still not sufficient for Entebbe Regional Referral Hospital to serve the population that it does have. We have a population of 4.3 million that is served by 21%. And you are the one who complains about congestion. The patients are many. The other time I told you, when one is told that you have been admitted to Entebbe Regional Referral Hospital, being close to State House and the criticality of that road, one might think that you are among the best hospitals that we have in the country. So Entebbe, we still take note of the challenges of understaffing. You don't have staff. Let's go to 2.2, that is review of critical service delivery in areas of the hospital. Human resource management, we have talked about that, about the structure, we're not going to repeat it. Understaffing, the same issue. Inspection of your stores. When the auditor inspected the stores to ascertain whether medicines and health supplies were stored in accordance with the storage conditions as recommended by the manufacturer, these were found out. Storage space was inadequate, pallets were available but not adequate, some drugs were stored in corridors, office consumables like stationery were stored in the drug store, newly delivered supplies did not have space to be stored in. How I wish these photos were colored. One would have seen the state of the stores of Entebbe Regional Referral Hospital. So, sir, what are you doing to really ensure that you have adequate storage? Because number one, this affects the drugs that you do store. And it is very dangerous to the patients. You might even end up giving us expired drugs because the stores person cannot know those that came in first and those that came in last. You just pile everything in the stores, which is so risky to the population that you do serve. So why don't we have adequate storage space for these medical supplies and these others? And why do you have the stationery stored in these medical stores?
Well, thank you very much. We have limited storage facilities at our place, and what we are doing as management, we are handling this in two ways. One, we have.
I want you to remind us, for how long have you been? When were you upgraded to a regional referral hospital?
2019. July
Those are 6 years.
These are 6
so
years.
A 6-year-old regional referral hospital cannot even have a space for storage of drugs, don't you think you are prematurely elevated? Because, honorable colleagues, if you cannot have stores, what else can you have? You don't have stores. Can you have wards when you don't have stores? This is a very serious matter. These are very, very basic, simple things. Anyway, give us the reasons as to why you don't have.
Yes. So we are approaching this in two ways. One, in a short term, we have requested for a 40-foot container from National Medical Stores, which we can use for storage in the meantime for some of the extra items that we receive. But then
you have asked for a container from?
And National Medical Stores. The request is attached as an annex to this.
Is that within their mandate?
No, we got.
Director, why don't you plan for a container within your budget? Do you have to go begging? Because National Medical Stores, I doubt whether it's their mandate to give you storage. I doubt.
Now we got to know that they have some containers which we would benefit from, and then this is.
But within your budget, can't you afford to buy a container? For God's sake, within your budget, you can't afford.
The problem is that our budget is really, really very low. It is very difficult.
How much is a container? Have you ever taken time to look for quotations for a container for you? Ugandans should fundraise for Entebbe Regional Referral Hospital to have a container, say that you can have our drugs stored better. Because the loss that we do get out of expired drugs and the inefficiencies that come about in regard to poor storage, for us we can take a move to mobilize for you resources. We can run a fundraising across the country for Entebbe to be helped. How much is a container? Have you ever interested yourselves in getting a quotation?
Yes, the container goes for about 7 million, but the way we have done also is we have a longer term plan, and the plan is...
Director, a container of 7 million cannot be part of a long term plan. We have a challenge of storage. A container of 7 million becomes a long term plan. Really, are we being serious as Entebbe?
The long term plan is actually to construct a new store, and currently we are having a project that we are seeking for approval, Ministry of Finance.
What stage is the project?
It's at feasibility level now.
Feasibility. Do you have any money that was allocated to you in the next financial year in regard to solving the challenge of storage?
Yeah, what we have planned in the next financial year is for us to make sure that we get this, in terms of development, constructing now, this one, because there is no money that has been allocated to us for this kind of putting up capital development for buildings, but we have allocated some funds to see how we can get temporary storage.
Director, is the Ministry of Health aware of this challenge?
We have informed the ministry about these challenges of.
Do you have evidence?
Yes, we have. Yes, we have evidence. We have communicated to them.
Which annex is that?
We have communicated to the ministry, generally telling them about the challenges we have with our low wage and money for maintenance of this. And this comes to annex number. There are some letter requests for support. We have written several letters.
Help the director. Director, as you do proceed, it's about the request
now
for...
Now go to annex number.
Go to annex 3B, request
3B,
for
yes.
a 40-feet container for...
Ministry of Finance, telling them, asking for more funds to support us on this kind of challenges that we have, and it is on Annex 3B. You can first see Annex 3A.
3A is to National Medical Stores.
3A.
This is 3B.
No.
Annex 3 is Development Committee decisions.
Now the one after that. The one after that. What is? There's something there to do, requisition of additional wage from the Ministry of Economy, Ministry of Finance. So we have tried to inform.
I'm looking for that one.
Even Annex 8.
3A. After 3A, I have 3B. The General Manager, National Medical Stores. Is that the one you are talking about?
5A.
Okay.
And 8. Annex 5A and Annex 8.
This is 6. The non-wage budget by 6 billion. Go straight and read where you talk about a container in your letter, because it is long. We can't read these many. There are so many areas. You look for where you talk about a container. And as your team gives us you said the cost is 7 million. The other time we made people fundraise for you to get a bed. This time around, before you leave this place, Ugandans will have known that you don't have a storage space and they will contribute for you. I think even the people of Vuma Island. But Butambala is a beneficiary. The chair is here. Butambala is among those that are served by by this very regional referral hospital. So the people of Butambala are going to contribute for you to get a container. But Maogola will also help. And I'm serious. Before you leave this place, you will find somebody having delivered a 40-feet container to Entebbe for Ugandans to show their seriousness about the quality of services that they do require. Colleagues, with due respect, this is purely unacceptable. A whole government to fail to buy a 40-feet container of 7 million. Even if we are here, if you can pass a basket, we can raise the 7 million and buy you a container by the way. Eh? No, the chair cannot. But on a serious note, eh? But I mean, when government fails, what do? Yes. If government fails, you donate for the beauty, I mean, for emphasis of Ugandans getting quality services. Eh? Susan donated a whole facility, health facility. For me, I donated the land for a government that cannot purchase land to construct a health center. We gave them land. So, Director, let's not even waste time. We've seen you made your request under 3B to National Medical Stores to really help you. This is, if it is National Medical Stores, this is equivalent to a fundraising, because it has never been the mandate of National Medical Stores to give you storage. If they do that, that is charity. So, sir, this year, this is 2025. Today is 9th. We are going to call upon Ugandans to really fundraise for Entebbe Regional Referral Hospital to get a 40-feet container to have our drugs stored well. Because out of this challenge, first of all, we risk drugs to getting expired. We risk our lives. So we are going to rescue you, sir. This is not it's not your failure. We can't blame you for this, but we are blaming whoever is responsible. And honorable colleagues, I think as a committee, we need to notify the PS, Madam Dana Twine, about this matter. Because this is not in the next financial year's budget, but the entity is trying to do a fundraising from National Medical Stores. So the country is going to help you. Good enough, you go to the 7 beds. So we are making a move to ensure that you get a container as government looks out to giving you permanent structures. Do you have land for where you can put the structures?
Yes, we have.
Even they can go ahead to donate a building if you don't have.
We have space for a storage building.
Colleagues, we can proceed, but it is an embarrassment for a regional. We are not talking about a health center 2, not a health center 3, not a health center 4, not a district hospital, but a regional. You said you serve how many districts?
We serve 6 districts.
6 districts, inclusive of Mpigi, Butambala. The chair is here. Butambala, he comes from Butambala. Buvuma is also served by you.
Buvuma, no.
Buvuma not. I'm also not part. But we feel sorry for Ugandans that you do serve. So we take note, honorable colleagues, of the issue of the challenge of stores. Yes, Chair. Butambala.
No, we will need the store, of course, because we serve. Even you MPs use it. Just imagine you go to the airport, MPs, you're always on the plane. We're always on the plane on the chair. Something happens.
We are looking at the orders that you do make. versus what you receive. The auditor noted discrepancies between the quantity ordered by the regional referral hospital and the quantity delivered by Nakasero Blood Bank. And we are looking at the figures here, but most alarming is on item, it is close to 8, where you ordered for 250, are they supposed to be liters? And you only got 103. There was a discrepancy of 147. When you go to the next page, there is where you asked for 210 liters, they supplied 135, a discrepancy of 75. You ordered for 160, they supplied 160, they supplied 13, and you only received, the difference was 147. So the total of what you ordered was 2,304 liters. You only received 1,238. Get us a percentage, Isma, get us a percentage of this, whoever can. Honorable Sewung, mathematician, sir. Get us the difference.
Madam Chair, I don't want to look at the variances, but my interest is on the recommendations.
So, no, but it is also, want to know the percentage. Susan, do it. We need to know the percentage. So these discrepancies cause blood stockouts, which could affect the ability of the regional referral hospital to provide adequate health care. So Susan, as you do compute, Honorable, as you do compute this percentage of supply, accounting officer, what is the problem?
Yes, as a hospital, we make this route from Nakasero Blood Bank, and we utilize what Nakasero is able to provide with us. But as a regional referral hospital, we don't have the mandate to collect blood.
What reasons do they give for such shortages?
Yeah, the reason is mainly because that even on their side, they don't have enough blood. One, it could be because of also the number of people who are donating blood, because this is a product which is not manufactured from a factory. So it has to come to do with our blood donation culture as people, but then the other, it may be related to resources.
How much do you sell blood at your referral hospital?
No, at blood we don't sell blood. Blood is
Honorable members, order please.
Free. It is not charged at all. Actually, in Uganda we don't charge.
In Uganda we don't charge for.
No.
So the people should know that when you go to the regional referral hospital of Entebbe, you get blood free of charge as long as it's needed.
Blood is free in Entebbe Regional Referral Hospital.
And how have you been affected by this shortage in supply of blood? Tell us the consequences to the hospital.
Now, what happens is there are also other alternatives, other products, alternatives, which are manufactured that can almost equate to blood, and these are the ones that we use.
Which are those alternatives?
No, we have like dextran, iron sucrose.
In terms of medicine?
In terms of medicine, which we can take, which we can give to patients, and they can actually help the patient build up.
So that means even if Nakasero failed to supply you, or they gave low quantities for you, you can get alternatives.
We can use these other alternatives for those who are not.
Doctor, as you commit yourself, be serious. You ask for blood, you make a request. They don't supply. For you want to tell us that even if they don't give you blood, it doesn't affect you in any way. You have alternatives, because let's get serious. We are looking for a solution of shortage of blood in your hospital. Now when you come here and tell us that, even if they don't supply, for me I look for drugs that supplement. Are we being fair? Honorable Sewung?
Madam Chair, I think when we get time we shall have an in-house on some of the where you will go to Nakasero Blood Bank and say, I want my collection as in the regional referral. What this gentleman is saying is correct. Once blood is collected, it goes through other processes at Nakasero Blood Bank. The biggest question would come to Nakasero Blood Bank to explain how much blood they offer to Entebbe. But the problem with these technocrats, they think they must answer each and everything to appease us. That is very funny. Because, Doctor, Mr. Counting Office, we have been to Entebbe, even if Museveni got an accident this night and there is no blood with these specialists he's using in the State House, you might not be having blood at that particular time at that place because of the low collections and the processes of getting blood out. You have hemophilic children. You know what hemophilia is? Me, I'm not a medic. What do you require out of that? The precipitate and others. But what we would like to say, Madam Chair, is that we as a committee, we want to ask Nakasero Blood Bank what role it plays vis-a-vis the regional referral hospitals to mobilize in the collection of blood. Because there is nobody who research. We Masaka regional referral, we collected 1,000 liters, we want them as we gave them to you. There's nothing like that. I think what I'm saying is what you should be telling us. So don't you make the chair ask you funny, tough questions by giving alternatives of other forms of creation of blood in the body, which are not available in your budget, your procurement process in NMS. Could you give him all how many units of that kind of medicine you got from NMS for your hospital? Can you tell us, if we are asking you here to bring your procurement plan from NMS vis-a-vis your budget, how many tabs did you buy for that kind of blood? You don't have them. You don't. You're just shaking your head.
Thank you, Honorable. Thank you, Honorable. Colleagues, I just want you to...
What you're saying is also true, but truth be told, sometimes there's blood shortage even in the blood bank, and some people cannot even afford. And you cannot just risk to get blood which is not checked, which is not screened, which is not matched for anything. So these people go ahead to request. Yes, they can request, but how about if it is not in the blood bank? I think this query is redundant. We should be forwarding this query to Nakasero Blood Bank, not to Entebbe, because they did their part. They have showed you what they requested for and what they were given. Are they going to fight for this blood?
Yes, Honorable Victoria.
Thank you, Chair. Just in addition to what my colleagues are talking and what they for blood, for us as a Secretarial Committee on Health, Nakasero Blood Bank is the institution that's mandated to do that, or to do with the blood and blood products. So these are recipients, but again with Nakasero, they sometimes get shortages, especially when the youth who do a lot of donations, like in time for school, are in school, are on holiday. So when there's shortages in that time when most of the school children, university people are on holidays, it's hard to mobilize them, so there are shortages. But however, they have the mandate and they're given the facilitation to do whatever possibly they can do. And I think they do a fair job from our analysis as a secretarial committee. Just that those shortages are sometimes beyond them also, but they do a good job. So for the accounting officer, I'm sure they get stranded when there isn't blood, but they work, they have a good relationship. And we as the end committee have not got so much to blame the hospitals for not doing that. And so when it comes to accountability, probably, Chair, I think it's Nakasero Blood Bank to answer anything with the blood. These are only end user consumers. The requisition, yes, if there's nothing, if they bring, but nobody sells blood, so they can't say we shall get privately for any other reason.
So, honorable colleagues, I want to thank you for... Yes,
Chair,
Honorable.
I think there is a big issue here, not particularly the availability of blood supply in a country. Taking Entebbe as an example, because if you take Entebbe as an example, for all they ordered, they were able to only be given half, if I'm right. When you look at the order of 2,300, the variance is 1,238. So all
That is 60%?
60% not delivered.
Delivered.
60% delivered. 40% not delivered. Taking it as a sample across the country, and this could be a little privileged. The question, when you go to those up-country hospitals.
Honorable members, order.
When you go to those up-country district hospitals, what do you find there? The question is, you may hardly find supply of blood. And this increases the level of traffic of ambulances that want to go wherever there is blood. You'll find an ambulance. I have an ambulance there. Sometimes some of the things, the patients, they deliver to Chirudu, to Entebbe, to Masaka, can be treated, handled in, but because of this shortage of supplies of some of these essential things, then they say, transfer. They simply, these doctors there say, transfer to Entebbe, transfer to Kawempe, transfer to Chirudu, transfer to what? And you find an ambulance, mine goes 5 to 6 times a day from Gombo Hospital to one of these hospitals. 5, 6 times a day. I monitor it. And it's because of the supplies. Could we pack this query? And Chair, if time allows, have Nakasero Blood Bank appear here to tell us about the whole thing about for the accountability. They don't belong here. I think they are under Kosase. But yes, they are under Kosase. So they can come here for this query and tell us the status of viability as the need arises for blood, because it's about life. Blood inadequacy really can take away your life, if I'm not mistaken.
It takes away.
It takes away your life. So non-viability means you are pushing people towards the grave at any given time. So it's not a query we will just dismiss and say it's about Entebbe. Entebbe has given us a sample of what it is. If time allows, we either write to Nakasero Blood Bank to give us a full account of their annual supply of blood and how much they delivered to all the various units in the country. Let them account, because so many people donate blood and blah, blah. Is it enough? Is it adequate? Do they have enough capacity to bank enough blood in the country? Because, of course, not all blood in Uganda is transferable, but some of the blood has issues. But we want to look at the whole blood bank situation in a country.
Thank you, Honorable Mwanga, and colleagues. I want to end user of the service. Blood is very essential and timely. Most of us are mothers. We've gone to deliver. You need blood, and once it's not there, we shall lose lives. So, honorable colleagues, I want to thank Buganda Kingdom. It has moved out to fund, to collect blood. We have donated. It has moved the donation campaign. So even this comes back to us as leaders. If we really realize that there is shortage of blood, what do we do? Because the NGOs have come out, Buganda Kingdom has done it, government to some extent through the Ministry of Health has done.
Chair.
So Busoga Kingdom has also done.
Chair, what you're saying is all right. But truth be told, Abantu Barade, they cannot give you sick blood. Once they get this blood, you can find that out of 1,000 pints that have been collected, maybe you get like 200 only, which is still okay.
So that is why...
These children, which you are saying that the children at school, we are producing these children when they are sick. And there's nowhere to go. So we simply need to appreciate the fact that we have tried all ways, but people are sick, and we cannot distribute blood which is sick. Normally what they do the screening, and if it is found that it is sick, it is banned.
So, Honorable Amero, that's colleagues, I want you to take note of this. Please, this is a policy matter, but our accountability feeds into other processes. So if we take note of issues of blood, don't say this is the policy, please let us leave.
Madam Chair,
so no, Honorable.
Madam Chair, I'm seeking for your guidance as my chair. When we go for accountability, I agree with you. But once we disappear in the policy, we see why the honorable member was calling this a redundant issue on these people, because it is not theirs.
Let us not discuss, honorable colleagues.
It was addressed to the wrong people.
Let's not go to the discussion of redundancy. These are the users of blood. Somebody is telling you these people don't have blood. It should be noted here, honorable. So let's not discuss that with due respect. Let's not go into that discussion.
That's
honorable
why I
colleagues.
told you that we need an in-house.
Honorable colleagues, honorable so kindly restrain from that argument as the chair. I'm requesting you to restrain. Honorable colleagues, as we do serve parliament, each system feeds into the other. That is why even at times we used to ask these other sectoral committees to attend some of these accountability committees so that they can know that these matters do come out. So if accountability does not bring it out, how will they know that we have such challenges? So I kindly request you to restrain ourselves from taking such, unnecessary arguments. Yet, Honorable Basalirwa.
Chair, it is really unavoidable.
Please, Honorable Song, order, please.
Policy, to discuss accountability delving into policy. In fact, in some instances, the line is too thin to discern. So I want to propose, Chair, that where in the process of our discussion, policy issues arise, it does no harm for us to make mention of them, but not losing focus of the fact that we are an accountability committee. We should just not lose focus. But to say we should not take cognizance of the policy issues, I think would really be unfair. So, Chair, I want to beseech my colleagues that once in a while we will find ourselves delving into policy matters. We are not the sectoral committee, but sometimes it's unavoidable. And when it happens, let's take it in good faith. Chair, my name is Vasali Rasman. I come from Bujiri. I hadn't introduced myself. I thank you, Chair.
Chair, just one from me, Chair, please.
Drives, we want to thank them. You serve as a prince. So,
Catholic Church.
And the Catholic Church has done so. So the country should take note that we have challenges of blood in the country, and I do encourage every Ugandan who can donate blood. Please do so for purposes of saving lives of those our colleagues, and even saving our own lives, because you cannot know when you will need the what? When you will need the blood. So,
and Madam Chair, they stopped NUP from collecting blood.
They stopped NUP from collecting blood. When was that?
Some time back.
You have evidence?
And the opposition, yes, that the blood was enough.
They stopped, it was everywhere? So that is very, very, very unpleasant and unacceptable. So NUP so they said the blood was more than enough. We want to inform the country that it is very unfair to stop Ugandans who are willing to mobilize the community to collect blood, because we have a shortage. Honorable colleagues, Entebbe might be at 60% supply, but you don't know what is in other referral hospitals. So we should take this serious, and if GEMA, if you can also do it, please do. And PEFF, the new pattern board, I don't know whether NRM has ever done the same. This is not a political issue, but as leaders, we must move in on a serious note to the one of NRM will be rejected. So,
Chair, in the same vein, Chair, what I would add on to what you're saying, the Ministry of Education, school children mobilized to do, and the biggest contribution are from school children, the youth. So we also need to commend them for that, because Drive has worked a lot. And when the children go off in holidays, how to mobilize. So when they school collectively, they do get good amounts of blood that saves Ugandans. And alternatively, Chair, besides blood that has issues now, we also advocate that we work hard as the government, included as the chair of the policy, of the committee, that we make as he mentioned it, that the accounting officer can have other alternatives that the human blood that are manufactured. So maybe in our budgets, in our planning, futuristic purposes, we can manufacture blood alternatives to that. Thank you.
So we shall go into that, but I do commend every institution,
and these are the boxes where we keep the blood, and mainly this is what we have done. And then also we have increased the capacity of our fridge. We acquired a new fridge, which is where we keep this blood. But the major issue was, as highlighted in the audit, it was mainly about transportation, and for this we have the
so we are now safe.
Boxes.
But
yes, and the photos are attached.
Let him first finish.
And the evidence for the whatever are attached on annex number 4, the photos of the cool boxes which were bought.
The bad thing is they are in black and white. We cannot. Yes, Honorable Song, as we look for the photos
you are
of
telling
the boxes.
us, you are giving us what happens, what you have done now, but we are looking at the query as of then. What stopped you from procuring these facilities at that time, and how much does each cost? Can you tell us how much does each of these cost? Could you help us through the chair?
Entebbe Regional Referral Hospital is one of the, actually it may be the least funded hospital.
No, you are not answering my questions, Madam Chair. I'm
Honorable
asking
Susan,
you,
order.
how much does that facility cost? Because they said you had only one, and now you said you have bought. How much does it cost?
1.6. It depends on really on the range, the size of the cool box that you are buying.
Okay.
But
You see,
it is
Mr. Accounting Officer,
1.6
you are
million.
taking long on a simple question. How much does that cooling facility cost? Or how much did you buy the ones you have now?
1.6
million.
1.6 million.
Now, why could you fail with all your meager resources, fail to buy such, and it became an audit query? The weakness goes on you. 1.6 million to buy 2 coolers to transport blood, fresh, Madam Chair, who need this blood. But you have a container, I'm imagining, as the auditors say, you have one which is bringing at least 20 per box. So meaning the blood you get from Nakasero Blood Bank, as per the ratio given here, ends up being spoiled because of your weakness in budgeting and preparing for the patients. Because we cannot tell us as a committee that you will jubilate over you are having them now, but you never had them at the right time, yet patients needed blood in quantities. That's a weakness you must correct. So don't think that this committee will be pleased by telling us that now they are in place. What happened at that time when you needed them? People might have died, blood might have been wasted, which is not easily corrected from the public. I don't know whether you are getting what I'm saying. Good, you are shaking your head. Thank you.
Accounting Officer, we do appreciate, because by last financial, that was 22-23, Entebbe Regional Referral Hospital had a budget of 5 billion, 5.6 around there to 6 billion. We do appreciate that it was slightly less, but one wonders, why were you upgraded to that status when government could not afford? You know, by that time we asked, because Entebbe was equivalent to a health center 3 in Matete. Matete is Sembabule, and you know what Sembabule means, a rural area. But we have something called a regional referral hospital of Entebbe, where somebody is referred from those 5 districts that we talked about, from Mpigi, Wachiso, from Butambala, is transferred to regional referral hospital of Entebbe on assumption that there are better services than where you have come from. Then they bring you to an area that even has lower services than where you have come from.
And Madam Chair,
you see?
Why I'm serious on this, 3 million procuring such containers is not a requirement to go to the PPDA for clearance, because it is below you call it what, threshold?
Yes.
So you cannot have such queries in your audit.
That you, Entebbe Referral Hospital Regional could not buy about a government. Entebbe is not a private hospital.
Actually, at that time we had a cool box.
You had the cool box, but they are saying
insufficient.
The cool box was insufficient, and it was small. It could not afford it would not afford to serve the purpose. So, honorable colleagues, we take note of this. But how much money have you been allocated as budget for 25-26? Because we need to see Entebbe funded more. How much money were you allocated?
For
no, the whole budget.
The whole budget is 18.7 billion.
18.7 billion. I think we can commend whoever has done it for that, because a shift from 5 billion, this financial, their budget was 11 billion to 18. Hopefully, Entebbe will now have, we shall see a regional referral hospital than a health center too, as you are at this time. Yes, Honorable Nsamba.
Thanks to you. And
in that line.
You'll have to give us a list.